Sometimes life throws bold moments at you, like finding the perfect vacation or finding the ideal location. At BOS, we're there to help you meet those moments with bold confidence. So whether it's managing money for future plans or getting what you need to start planning your dream, we're here to bring you a better banking experience. Make the bold move and switch to BOS today.
Hi, this is Ron Kincher. This is the Biz Spotlight brought to you by the Bank of Springfield. Today we have Keegan Harvey in. She is an RN, a radiologist nurse, and a navigator at Hannibal Regional Hospital. So you work with breast cancer patients, correct?
Yes.
So how did you become a navigator?
So I have been a nurse for 13 years. I started on med-surg, just getting my general education, my hands in there. I then went to surgery for 6 years. So I really got to see the back end, and I got to actually work with our breast surgeon that we have at Hannibal Regional, Dr. Copeland, on that end. So I guess you can say I did things backwards of taking care of those breast patients post-op, taking care of those patients intra-op, and now I am in radiology taking care of those patients through the radiology phase and helping them start at their mammograms.
So did you notice there's a need for this while you're in the post-op portion of your career? So did they come to you and ask you to do this, or was this? So
when I was in surgery and the job opening was for a radiology nurse. And then as I applied for that radiology nurse, then it was presented to me as, and also we would like to start this position as a breast navigator and get that going.
So when do you start engaging the patient? Is it after they're diagnosed or as soon as they walk in for the mammogram?
A lot of the times it's as soon as they walk in for their mammogram. So if they need to be called back for any additional imaging, I'm the one that gives them that call to say, hey, we need to bring you back in and get some additional imaging.
So what is your role starts then, and what does it, you're a navigator, so I'm assuming that you're like an advocate or a good friend for these people as they go through the process.
Yeah.
Is that right? So what do you basically help them with?
So I tell them I am there for them for any questions. Simple questions such as, I don't feel good, what can I do? Hard questions about insurance that I may know about, but I can get them to the person that they do need to know about. I also help them set up all of their appointments through radiology, get them in touch with our breast specialist, Dr. Copeland, or someone else of their choice. But I'm that phone call for them when they have that anxiety or just don't know who to turn to.
Do you find that a lot of women are more comfortable talking to you than they would their spouse or partner or people like that, as you are a woman? So?
Absolutely. I even find that they are more comfortable talking to me than their physician.
Really?
Yes, we start that relationship off very early. And I sit down with them and have a conversation as soon as before we biopsy them. So I think they get very comfortable with me, and they see my face so many times coming back for their appointments. I tried to make an effort to stop in and say, hey, how are you? So I think we build that trust with them.
Right.
That
Are you in the doctor's appointments with them too, if they want you to?
Absolutely.
Okay. I'm sure that helps. And you are not a survivor. I want to get that out. But you've obviously seen many people go through the process. Yes. What's one of the big misconceptions right now that you find women and men face when they come in to see you or come in for the mammogram?
Yeah, so a lot of women still believe that a mammogram is painful. So a mammogram is not painful. We have amazing mam techs that I work with that are going to go at your speed, your comfort. They're going to talk you through this the entire way. Another thing, we have patients that are they're still in denial. They don't want to know if they have breast cancer. But what they need to know is we want to prevent this. We want to find this as early as possible. You don't just because you have breast cancer doesn't mean you're going to lose your breast. Doesn't mean worst case scenario. If we find this as soon as possible, we want the least invasive treatment for you.
Do you find that people don't want to come in and get the mammogram because they're afraid they'll be positive and then they'll need the mastectomy?
Absolutely.
Wow. Okay. Yep. Can you so you have some technology over there that can, I don't want to say predict, but let people know whether they're high risk or not, correct?
Yeah, so we use what we call the Tyrer-Cuzick score.
Okay.
So every time a woman comes in to get her mammogram, we calculate this score for them. This is going to tell them if they are normal risk, so not at risk at all, intermediate risk, so you're in that middle range, we need to start keeping an eye on you, or if you're at high risk. If you are at high risk, this does not automatically say you're going to have breast cancer, you're going to get breast cancer. Mm-hmm. This just says you have higher risk factors that we really need to keep a closer eye on you. What we would do then is refer you to our high risk program,
right,
which you would see our breast specialist, offer you genetic testing, and offer you an annual breast MRI that would be 6 months from your mammogram.
So if you determine somebody is intermediate or high risk, mm-hmm, are there things that can be done to help prevent them get breast cancer? I mean,
there are things you can do to reduce your risk factor. Okay. Eat healthy, don't smoke, don't drink, exercise regularly.
So it's basically a lifestyle type choice.
A lifestyle change. We can't change if we have family history of breast cancer.
Okay.
You know, that is what it is. We can't necessarily change our breast density, which we take into effect. Mm-hmm. But there are some things we can do, like change your lifestyle.
Okay, so if there is a history, mm-hmm, how soon should that patient start getting, and I'm sorry, this may be a stupid question, but how soon should that patient start getting mammograms? Or how soon should they, even if they don't have a history?
Yeah, so we recommend women start getting their mammograms at 40 years of age. However, if you have a first degree relative that had breast cancer at 45, we then want you to talk to your physician, and we are probably going to recommend you start getting those annual mammograms at 35. So okay, 10 years prior to that relative having breast cancer.
And a first degree relative is?
Your mom,
sister,
your
aunt,
sister.
What about an aunt,
yes,
uncle? Aunt? Okay.
That first degree.
Okay. As far as I hate to say technology, but the treatment options that are available now, how far have we come in the last 5 years as far as preventing death? I know the death rates are low if it's caught early, but it's still a risk. But
yeah, we're making ways. That's why we want to catch it as soon as possible so we can get you in. Our main goal is for you to have a lumpectomy. We don't want you to come in and it be worst case scenario and it's been 10 years since you've had a mammogram and looking like a mastectomy. We want you to come in every year so we can catch this, mm-hmm, as soon as possible, do the least invasive treatment possible for you.
How often is chemo a part of the treatment for patients? Does that happen even if you need a lumpectomy?
Yeah, it happens even if you need that lumpectomy. It all depends on the type of breast cancer you have. There's so many different variations of breast cancer and treatment options, mm-hmm, out there.
If it was somebody I knew and loved, what I would be more concerned about almost than the breast cancer, because if they caught it early, okay, we're probably going to be okay, is the recurring of the cancer someplace else or within that same breast or other, mm-hmm, breast. Is that something that is actually true or something to be concerned about?
Absolutely. You know, it can come back. We have seen women come back to us with recurrence. Mm-hmm. That is, you will continue to be monitored after your breast cancer. You are not just going to get released. Mm-hmm. They will have a treatment plan for you afterwards to continue to monitor.
Is it still a lifestyle type treatment plan, or is it, is there medication you can take to help now?
There
or anything
will
along
be,
those lines?
For some breast cancers, there is an oral medication that they will put you on, mm-hmm, for a period of time after all of your treatments. Others, we are going to continue for all to do either MRIs or your MAM screenings.
Okay. So let's say you're 30, 35, and you're, mm-hmm, not ready to have those annual mammograms. Yep. So what are there signs that you may have that would lead you to call someone like you or to call the hospital and come on in and get that test done?
Yes. If you feel anything abnormal in your breast at all, lumps, bumps, any kind of mass, let your physician know. That is a reason to come on in. They will most likely order what we call diagnostic mammogram, which is when we focus on certain areas of the breast that you are feeling that.
Is there always something like that for the patient, or could it be fatigue or anything along those lines that may lead to the diagnosis?
Typically, if you're going to feel something, unless we're just doing a screening.
Okay, all right. Well, thanks for coming in and telling us. It's Breast Cancer Awareness Month, correct?
It is.
All right, and you are a navigator to help folks through this.
Navigator to help everybody answer any questions that they have.
All right, Keegan, thanks for coming in.
Yep, thanks for having me.
This has been the Business Spotlight, brought to you by the Bank of Springfield.
Sometimes life throws bold moments at you, like finding the perfect vacation or finding the ideal location. At BOS, we're there to help you meet those moments with bold confidence. So whether it's managing money for future plans or getting what you need to start planning your dream, we're here to bring you a better banking experience. Make the bold move and switch to BOS today.